Weekend Prime with Dennis Asato.
Our sign language interpreter is Damien Evans. Remember that you're also streaming live on standardmedia.co.ke and on our YouTube channel as well. Talk to us on our social media pages at KTN News KE, at Dennis Asato. Our hashtag is Weekend Prime. And now we go straight to our top story. These are tonight. We can report that health services at public hospitals across the country are likely to be disrupted during the Christmas period starting 22nd of December. This is after the Kenya Medical Pharmacist and Dentist Union, KMPDU, announced that their strike is still on, despite the Ministry of Health announcing progress of some of their complaints. Among the contentious issues include delays and reinstatement of salaries for medical interns and delayed promotions for consultant doctors. Ken Gashugi starts our bulletin tonight with the expected paralyses in public hospitals after other unions, KUKO and non-KNUN, indicated their plans to down their tools.
This year's Christmas season may not be festive to Kenyans, especially those who will need medical services. The Kenya Medical Pharmacists and Dentists Union, KMPDU, has reiterated that its planned strike is still on and will start on December 22nd over unfulfilled government promises.
And we are telling national government, we are telling county government that we have no time for boardrooms. We have no time for negotiation because we negotiated in 2023. We negotiated in 2024 during the 56-day strike. We have negotiated between May and now December. This is time of action.
The union leaders spoke in Kakamega where they raised concerns over poor working environment, delays and reduction of salaries specifically for medical interns, and promotion of consultant doctors.
We have seen a situation in Kakamega now where they put doctors on a daily wages. You are engaged for only 1 day and at most for only 1 week. It's a big shame.
The senior consultants in Kakamega County are condemning strongly the non-implemented promotions. Most of the senior consultants are willing, and some of them have resigned.
Earlier this week, Health Cabinet Secretary Deborah Barasa announced that the government had released 965 million shillings to pay the arrears of the various health workers' interns accrued over the last 4 months. However, the union has maintained that their demand is the reinstatement of the previous salaries of medical interns as per their CBA.
And we'll only come back when we see those letters of promotion. We will only come back when we see the money in our account if the CBA is bastardized to ensure that interns' wages are reduced to 41,000 the way they did, then no doctor is safe.
The doctors have also decried over their security after Vihiga County Hospital Medical Superintendent Dr. Victor Zimbulu was viciously attacked by unknown people earlier this week as he was heading home from work.
You've seen doctors being attacked in Nairobi. You've seen doctors being attacked in Kiambu. So yes, it's a situation that needs to be handled urgently.
As is power.
At the same time, the Kenya National Union of Nurses has issued a 21-day strike notice over what they termed as discrimination against nurses in the country. The Union Secretary General Seth Panyako has announced that nurses will not report on duty in January if the government fails to address their grievances.
We have given them ample time to serve Kenyans and meet their commitment to health workers and specifically the nurses. But it appears that our being silent and not disturbing this government is being taken for granted or being cowartized.
Just yesterday, the Kenya Union of Clinical Officers announced it will withdraw clinician services starting this Monday if the Social Health Authority Board is not disbanded.
We need those people who have formed a cartel and bringing back the bad practices from the National Health Insurance Fund to be sent home.
Ken Shuhi, KTN.
And that story by Ken Gashuhi leads us to our big key tonight, where we ask you, are medics justified to go on strike over their unmet demands? I repeat, are medics justified to go on strike over their unmet demands? Send your responses to our toll-free number, 22151. Again, 22151 is our toll-free number. Tag us on X at Dennis Assetto, at KTN News KE. Our hashtag is Weekend Prime. We will sample some of your views and read them in the course of this live newscast. And we ask, are medics justified to go on strike over their unmet demands? Is our big Q tonight. And President William Ruto has commended the Kenya Navy